William. So now's the time to put your questions in the Q&A. Welcome, Jordyn. Welcome, William.
Thank you for having us.
Hello, Jason. Thank you for having us. Yep.
Thanks for your presentation and your work. I want to ask a few questions just to get us started. One of your partners isn't here. It's the Human Rights Watch. Tell us a little bit about their participation in this project.
Uh, so this, work really began in 2000, summer of 2023, when NILPI, New York Lawyers for the Public Interest and Human Rights Watch, started the initial national survey of non-police response programs that are out there. So that research lasted several months. And then, for the phase two part of the project, which is the report writing part, that's when Jordyn's organization, Center for Racial Disability Justice at UCLA Law, joined to write the report together. So HRW is not here today because, the original the one of the authors, Olivia Ensign, she went to a different organization. So yeah, there were some staffing changes. So, because of that, HRW couldn't join as part of today's presentation, but they have been great partners and we've been all working together jointly. So
Well, great. Your
yeah.
report is coming out at the end of this month. We're all looking forward to it. Um, Again, if folks want to read the work, the list of all 50, almost 50. I don't think you got Arkansas. There's nothing going on in Arkansas. But most of the states, Google HRW, uh, and it's NYPLI, and it'll bring up a page, and then there'll be a little thing, download this, and you'll download a little Excel spreadsheet, and you'll be able to see the work, the list of all of the programs that Jordyn and William were looking at. You found a lot of programs. There's a lot more, of course, out there. But what was you saw these trends, but were you able to see sort of like what was the growing best practice amongst these as far as rights-based response models? What's the growing trend? William or Jordyn?
So I guess I'll just start off by saying that's what we wanted to capture in our report. So I'll be on the lookout for that.
Oh,
Um, uh, So I think, I mean, when we started looking at the programs, there were many different models that are out there. Co-response models there were a lot of them, but we, specifically wanted to focus on non-police response models. And, our research really was building upon the Human Rights Watch's previous report on the Gerstein Center in Toronto, Canada. So, and if you look at that, just you can, just Google it, HRW Gerstein report. It really goes in depth into the rights-based practice of the Gerstein Center. So that was, probably the rights respecting model that we were trying to look at. And with that lens, we were trying to look at, a lot of programs that are in the US. Of course, there are, a lot of good programs that are out there, and a lot of them were, we found that were modeled after Cahoots, which has been around for many years, although there was some recent funding issues, there. So, Jordyn, if you wanna add anything, yeah.
Yeah, thank you, William. I'll just add, what we saw in our research is not a single, best practice, but rather a set of emerging design principles across programs. And so some of what we highlight in the report, which I believe we highlighted in our presentation a little bit as well, is removing police as default responders, embedding peer participation across multiple levels. From leadership positions to, being direct responders, operating through consent-centered and voluntary approaches, and ensuring community-based governance and involvement. And so we also saw growing alignment around integration with 988, focus on like minimizing power imbalances and building pathways for follow-up care rather than one-time crisis stabilization.
so you saw peers as really being very influential in some of these programs.
Yes.
and not just at the, hello, I'm a person like you rapport building, but also in management.
Yeah, there were several programs I think we found that peers were involved in their like oversight bodies and the community advisory boards and et cetera as well. Yeah.
I want to invite Dandy Wagner into the discussion. Dandy has a question. Amir, can you bring Dandy in?
Bring in Dandy in now.
Hey, Dandy, you have a great question, sort of relates to something that was discussed earlier in the day about liability, but you're connecting it to the co-responder model and maybe why this system is a little resistant. Dandy, are you with us?
Just waiting on Dandy to accept the invite.
Oh, we've got a little hitch in the technology here.
Hi,
Okay,
can you
well,
guys hear me?
hey, Dandy.
Hey. Yeah, I'm in Portland, and some of the stuff I've seen around harm reduction efforts here in the recent past, has really been stymied mostly by insurance. And so I was
Hmm.
wondering how much fear of liability connects to like local government continuing to insist on either sending police first or along with, and like what are some solutions people have come up with if that came up in your research?
Thanks, Dandy. Jordan or William?
William, I feel like you'd be best equipped to answer that given your role with like Daniel's Law and stuff. So if you want to take that.
Hmm.
So, so can I actually ask you, can I actually, I didn't hear the last part. Would you mind clarifying the question again? Sorry. Yeah. I think you cut off a little bit. Yeah.
Um,
Yeah.
has like basically the issue of like insurance coverage
Hmm.
been like a pressure on local governments, and like when you were like researching this, did
Yeah.
any of the entities that you interacted with like discuss solutions they'd come up with for that issue that were effective?
I think, that has always been an issue, it seems like, and a lot of entities that we spoke with were trying to figure that out. We hear that, a lot of them were as a at the very pilot stage that they were not really billing anybody, at the very beginning, but they're coming up with a lot of pressure now because the program costs and whatnot. So what we hear was that they are trying to figure out ways to bill insurance, private insurance, and also like Medicaid and their state Medicaid as well. So those were discussed, but I think a lot of times they were still trying to figure out what they can do, in terms of Medicaid coverage. But a lot of them, had concerns about they still want to provide, free services and they don't want to turn down anybody. And as far as, the programs that we cover, they didn't turn down anybody based on whether they have insurance or not. But
I'm
I think
sorry,
those were
I
issues. Yeah.
didn't actually
Yeah.
mean medical
Hmm.
insurance. I meant
Okay.
like local government's fear of being sued having to
Oh,
do
okay. I
with them
see.
insisting on sending police.
I see.
Municipal liability.
Okay. Um, I don't think I don't think we really, covered that issue as part of our research. Yeah, so I'm not really sure if I'm in the best position to answer that question. Yeah, sorry.
We
No
did look
worries.
for
Thank
a
you so
city
much.
attorney who's a peer to come on this
Hmm.
program and talk about that, but we were unable to find a city attorney who also would agree to be a peer. Dandy, did
Jason,
you have a
sir.
follow-up?
Sorry, Jason, sir. Um,
Well, we'll
just
move on. We'll move on. Um, Jordan, you mentioned, and I think this is helpful for context here. William, you're an expert in Daniel's Law, which is specific to New York State. Could you very briefly tell us what that is? Because that has a great deal of influence over how New York operates
Yes, so I wouldn't say I'm an expert, but my
in this
organization
room.
is part of a coalition that wrote the bill and is advocating to push the bill to pass the law. So Daniel Law is named after a person named Daniel Prude, who was killed by police while he was experiencing a mental health crisis. in Rochester, New York. So, what the Daniels Law will do is to create a statewide system in which non-police response teams can, be dispatched to mental health crisis calls. So, it's asking for peers to be included in the crisis response team as well as EMTs as well. So it has a lot of, it was introduced, I believe, 5 years ago, and we've been trying to push it for the past 4 or 5 years. We have a lot of sponsors, but it hasn't passed yet. But last year, the state passed a bill which included I believe, $6 million for pilot programs in 3 different areas. So there's a RFP that's going on right now to have 3 different cities start the program as pilots. So, and there was actually a Daniels Law task force that was formed by the state government a couple of years ago, which came up with a really great report recommending the adoption of a lot of things that Daniels Law proposes. So we're still pushing for it, and we're hoping, it'll get passed, in the next couple of years. Yeah.
I want to call in Stephanie Lewis from Alameda County. Stephanie, would you come in and explain the difference? You have a question in the chat or a distinguishing comment in the chat between high acuity teams and low acuity teams. And the two teams that Jordyn and William have looked at are the Mental Health First part of the Oakland Terrorism Project and then Macro. But Stephanie, could you come in and explain this difference to us? Hey there. Oh, unmute your mic. There you go.
There we go. Thank
Hi,
you.
Stephanie.
So thank you for this presentation. I'm on like 3 different screens, but and my question is in 2 parts because I hit the wrong button and it just went. So in Alameda County, we have a mobile crisis. We have a variety of mobile crisis teams, a police clinician model, a clinician EMT model, and then we have the 2 clinician model. This is in addition to the programs that you mentioned, macro program, which we work collaboratively with, and also the other program that we don't have much contact with. My question is around how do you operate mobile crisis teams with the goal of having no law enforcement involvement with staff who are part of a union. And it's pretty much a non-starter for me to staff our mobile crisis teams with unionized staff and tell them do not use law enforcement. Now, the way we have our team set up is that law enforcement is involved as needed on calls, but the clinicians are able to make that determination depending on the information that they receive at the time the referral is received. We don't have any county operated teams that we're encouraged to reduce the use of law enforcement whenever possible or not involve them when possible, but I cannot direct my staff to not involve law enforcement. So how do you get around the union issue related to this? Thank you.
The elephant in the room. William or Jordyn?
So maybe I'll start off. So I think that's one issue, that was difficult for us to research as well. So I think, our report doesn't necessarily call for removal of police officers and police involvement at all costs. So I think, we wanted to make that distinction clear that, we one of the criteria was removing police as initial or default responders to the mental health calls. So and Daniel's Law, which I mentioned earlier, which also calls for removal of police as initial or default responders, but it also envisions a situation where police can be involved if there is a immediate a danger to the staff members who are responding to the scene. So I think it's a really nuanced question that, and in terms of the union issue, I'm not really sure if have the expertise to answer that question specifically, because the issue is complicating. So Jordyn, I don't know if you want to add anything. Yeah.
Yeah. I don't think I have anything to add, but I think you summarized it well, William.
Thank you both. Jordyn has another good question. Jordyn's been asking a bunch of questions today, but he has a question about a paper from Talid El-Sabawi and Jennifer Carroll, published a couple years ago, on some model legislation. Are you familiar with this piece of writing that's linked in the question? If not, we'll need to pass on.
I don't think I'm familiar with this particular paper. I've read other work by these folks, though.
Yeah, Talid's great.
Yeah.
So let's back up then and talk a little bit more about, well, first a question about co-responder models. Did you find any co-responders that were including peers in their work intentionally?
Sorry, I missed the question. Sorry, Jason.
Did you
Yeah.
find any co-responder programs that were intentionally including peers in their work?
So, when we first began the research, we specifically did not include correspondence programs as part of our research. So, yeah, I'm not really sure if I can, answer that question. Yeah.
Okay.
Mhm.
Okay. We've just got a couple more minutes if someone else has another question. I see a lot of comments in the Q&A, but not very many clear questions. Did you find in any of these programs that they were doing training that was peer specific, that was specifically designed for people coming in with lived experience and not professional experience?
Yeah, I think we spoke to a couple. So some of the programs, were very intentional about having peers, be part of their teams and be the responders to the mental health calls that they get. So I think one of the programs, if so I'm trying to remember from top of my head, but they had a specific, very, very robust, training program for peers. And I think one of them was actually, sponsoring their peers responders to get the certification from their state for a peer specialist. So
Mm-hmm.
I think there was definitely a program or two that focused on those. Yeah.
Mm-hmm. Okay. Very good. Um, as we're closing out here, get out your crystal ball, and you are looking at all these programs and these trends that they have in common. Again, what do you see as your best model moving forward? What looks like it's going to be the dominant paradigm moving forward in mobile crisis? You saw some of these standards, but what do you see that's going to be the best?
I think that's a tough question to answer. And I don't think I have a specific answer, given that the reality is the landscape, differs based on where these programs are, geographically, as for one instance.
Well, it's very hard. The states really aren't comparable. Cities certainly aren't comparable. Programs, they're all designed independently of each other. There's no sort of, outside of SAMHSA's kind of aphorism about what we ought to do, not a lot of commonality, not a lot of a pattern. Is that detrimental, do you see, or is that spur people to be creative and listen to their community about what their community wants and needs?
I think how you just said it, honestly, Jason, is a good way to think of it. I do think that what we've seen in some of these programs, is creativity and how they involve community members to help build these programs out. But I would say that funding is one significant barrier. These braided funding streams and how a lot of it's grant based or federal funding, and what's happening, in our country right now. There's a lot of, administrative related struggles that these programs face.
I feel like I'm in a ship in the ocean, and one torpedo is hit, and I know 4 or 5 or more in the water coming towards me. It's a doomed time. William, we can't leave without hearing from you. You being in New York City, about Be Heard, which has the complexity of both the pattern issues and funding issues, but also has this new leadership of the city that's going to recharge what's happening there. What's going on in New York with Be Heard?
Yeah, so Be Heard is, a lot of you may know, it's a pilot program that started in New York City several years ago. But as advocates, we always say there's a lot of problem with the Be Heard program, although it's non-police model that sends out, non-police responders to mental health crisis calls. We think there's a lot of room for improvement, because not all the geographic areas of New York City are covered. So it's only like certain areas of New York City. And the program's not 24/7. And we also know that a lot of like co-responses happen. So we have always been saying, it can be improved for the better. As you might know, Mayor Mamdani said he's going to create a new Department of Community Safety, and then improve and strengthen Be Her program. So that's what he said. That's what he promised as part of his campaign. But we are not really seeing any blueprint come out yet. Because the administration has to create a new agency to do so. And we are seeing in the new budget that he came up with that there really wasn't a lot of discussion about this new, behavioral response program. So, I think it is to be seen. I think once he comes up with the final budget proposal, we'll be able to see more on what the administration is thinking. But we're, as advocates, really trying to push for the expansion of the Be Her program in the coming years. Yeah.
Well, thank you, William. That's very concise. We're all crossing our fingers. If it can work in New York, it can work anywhere.
Exactly. So that's why we were really hoping that, we could come up with a good program, that can be replicated in many other parts of the city, of the country. Yeah.
Stephanie has one last question for us. Did you find any programs that pay peers similar salaries to licensed staff? Equitable salaries?
That's a great question, but we didn't research that part, so I'm not really sure if I can
Okay,
answer
all
that.
you
Yeah.
researchers out there,
Yeah.
that's the next project.
Yeah.
Let's do a salary review. Thank you, Jordyn. Thank you, William. Thank you for your work. We're looking forward to your report, and we will, of course, post it in the Alternative Mobile Services Association weekly newsletter.
Thank you so much. Yeah, be on lookout. March 30th is when our report will be coming out. Thank you for having us.
Thank you all
Jason.
so much.